Welcome to Client Compliance and Patient Financial Assistance, the third module of the MD Labs Sales and Account Management Compliance Training Program. MD Labs is committed to providing the highest level of service for your practice, for your staff, and for your patients. We work hard every day to earn your trust, and we are committed to having a gold standard compliance program. As such, and in accordance with the recommendation made by the Office of Inspector General, as part of our Compliance Program Annual Review, we are supplying you with our most current policies and related forms. Going forward, our compliance program is structured for this annual notification to take place in the first quarter of each calendar year. The current MD Labs policies and related forms, included in our annual notification, will include, but are not limited to, the MD Labs Annual Disclosure Letter, the required acknowledgement and confirmation statement of medical staff within your practice with NPI numbers, a letter from Noridian Mac entitled, "Are you in compliance with CMS rules?" The most current MD Labs self-pay fee schedule, the MD Labs Financial Assistance Program Policy, the MD Labs Application for Financial Assistance, the new instructions for completion of the Medicare Advanced Beneficiary Notice of Non-Coverage, ABN, the new ABN forms in English and Spanish, and the MD Labs Request for Additional Information form and instructions. All of these documents are also available from our website at mdlabs.com/billing-resources. Beyond the documents, we also want to make sure the following policies are communicated to and understood by all our ordering providers and their staff. Only licensed physicians and non-physician practitioners can order tests for which Medicare or Medicaid reimbursement is sought. As of 2014, Medicare requires registration of all ordering providers to the Center for Medicare and Medicaid Services Provider Enrollment Chain and Ownership System, PECOS. More information on PECOS and how to enroll in the system may be viewed at https://pecos.cms.hhs.gov/providers/index.html. MD Labs will not accept orders for tests from any individuals or entities debarred, excluded, or otherwise declared ineligible from participation in federal or state-funded healthcare programs, or has lost their license to provide healthcare services. MD Labs will resume accepting orders with reasonable proof that the provider has been reinstated in federal or state-funded healthcare programs, or has had their license reinstated. If you should add new ordering providers to your practice, reach out to your MD Labs account representative to have that person added to your account. To verbally request additional tests to be added to an existing order, call MD Labs Customer Service at 775-391-5221, option 6, and an MD Labs representative will verify the specimen is available and adequate for testing. This additional order needs to be maintained in the patient's medical record. If MD Labs does not receive the signed add-on order request form promptly, it may cause a delay in reporting. Written verification for add-on test requests is required by the College of American Pathologists. MD Labs will honor test cancellation requests submitted before test completion. If the cancellation request is received after the specimen has been analyzed and the result has been produced, the request cannot be honored, and the usual test charge will be assessed. Section 4317 of the Balanced Budget Act of 1997 requires the physician or authorized ordering party to submit diagnosis information on the laboratory order for submission of a Medicare claim. The diagnosis information supplied needs to be coded to the highest level of specificity and accurately describe the patient's condition on the date of service, as documented in the patient's medical record. Tests that are medically necessary for the diagnosis or treatment of a Medicare patient are covered and are reimbursable. However, MD Labs cannot guarantee reimbursement from Medicare. MD Labs will not bill Medicare patients for laboratory testing that Medicare has determined is not reasonable and necessary, unless the patient has signed and submitted an advance beneficiary notice of non-coverage form before the collection of the specimen for the laboratory testing being ordered. Medicare does not cover all laboratory services. An advance beneficiary notice of non-coverage, ABN, is one of the most critical Medicare forms you can utilize. Medicare states it must be made available to the patient when Medicare does not consider an item or service to be reasonable and necessary according to the patient's diagnosis or Medicare policy. Examples of situations where an ABN is needed include when the test ordered is considered experimental, investigational, or research only, is not indicated for the diagnosis or treatment of the patient, exceeds the frequency of services allowed for a specific period for the corresponding diagnosis. A new ABN form needs to be signed by each encounter. The ABN is proof that the patient received notification that Medicare payment is expected to be denied for their laboratory services. As an informed consumer, the patient can then decide whether to accept the laboratory services as an out-of-pocket expense or through other insurance if available. Medicare's updated ABN form and instructions became effective on August 31, 2020, and have a planned expiration date of July 30, 2023. For your convenience, MD Labs provides these updated forms and instructions in our notification packet and on our website at mdlabs.com/billing-resources. Information and these forms can also be viewed on the Medicare website at www.cms.gov/medicare-general-information/BNI/ABN. To ensure prompt processing of your lab requisitions and to help eliminate the need for MD Labs to request additional information from your staff, the following information must be submitted with every lab requisition: the patient's full name, date of birth, gender, and address. The patient's insurance information, including insurer's name, address, and phone number. The ordering provider's name. Valid ICD-10 diagnosis codes defined to the highest level of specificity for each test ordered to confirm medical necessity. Valid ABN when mandated by Medicare NCD-LCD policy. When ordering a COVID-19 test, the street address cannot be a P.O. box. And in addition to the above information, you must also submit the county where the patient resides, along with their race and/or ethnicity. This is required by insurers and state and federal authorities. If any of this information is missing, we will need to contact your staff to obtain the missing information before the specimen is processed or the billing is submitted. We prefer to avoid having to do this, which is why submitting all the required information with the specimen is so important. Should you or your staff ever have any questions about what needs to be submitted, they can call our billing department at 775-499-5150. The Office of the Inspector General takes the position that physicians or other individuals authorized by law to order laboratory tests who knowingly cause a false claim submission to any federally funded program may be subject to sanctions or remedies available under civil, criminal, and administrative law, such as the False Claims Act. MD Labs fully complies with the Medicare Beneficiary Inducement Statute, Anti-Kickback Statute, AKS, Stark Law, and Eliminating Kickback and Recovery Act, ECRA. MD Labs prohibits its employees from offering or providing remuneration to clients or patients to induce or influence a physician, non-physician practitioners, and other types of clients to refer that patient's testing to MD Labs. MD Labs offers a financial assistance program for your qualifying patients who are having difficulty paying their laboratory test bills. We are able to provide financial assistance when your practice offers a similar discount or waiver of your own charges or fees. A copy of our financial assistance policy, as well as the application for financial assistance, are included with our annual notification packet and also located on our website at mdlabs.com/billing-resources. This completes Client Compliance and Patient Financial Assistance, the third module of the MD Labs Sales and Account Management Compliance Training Program. Our clients should direct any questions about this content to MD Labs Customer Service at 775-391-5221, option 6. Thank you. When results count, count on MD Labs.